In Module 1 of this e-learning activity, we reviewed the evidence underpinning HIV treatment as prevention. Dubbed the medical breakthrough of the year by Science magazine in 2011, treatment as prevention means that people living with HIV who are on successful treatment that leads to sustained viral suppression cannot transmit the virus to serodifferent sexual partners. This breakthrough is the scientific foundation for the community-based public health message known as undetectable equals untransmittable, or U equals U. U equals U is much more than just about its evidence base. U equals U has human dimensions. Module 2 of this e-course features video testimonials from people living with HIV. We have asked them to offer their personal reflections about what learning about treatment as prevention and U equals U has meant to them. We start this module by hearing from Asha, who achieved viral suppression in 2002. However, no clinician had ever told her until recently about what being undetectable meant, beyond the importance of monitoring her viral load as a laboratory value.
This is Asha Moloch from Philadelphia, Pennsylvania. I would like to thank you for U equals U. Since meeting you on Facebook and learning more about undetectable equals untransmittable, it has made me feel more confident in myself as a woman who is living with HIV. I've had an undetectable viral load since 2002, and no one has ever told me that I cannot transmit HIV to my partner. So armed with this information, I will be going back to my medical provider to sit down and have a serious talk about why this information was not given to me.
Diagnosed as HIV positive in 1985, Raul is a long-term survivor who says he lived most of his life with HIV carrying the heavy burden of feeling judged as an infectious disease vector. Persistent stigma is among the challenges that clinicians can play a part in addressing through integrating the U equals U message into clinical practice.
My name is Raul Robles. I tested positive for HIV in 1985, but I was told back then that I was positive for the AIDS virus. I'm still a healthy, almost 60-year-old man, sexually active, and full of dreams like many of you are. What the campaign of U equals U means to me is something very, very special. For many years, and this only a long-term survivor can agree with me, we were told that we were infectious, and find out or realize it that we are not. That's getting our life back. My message to the new generations: if you just test positive or a couple years ago for HIV, stay undetectable, protect yourself and others, and live your life to the fullest, like I am. Thank you.
Jennifer's HIV positive status impeded her sexual health. A single mother of 3, she was afraid to date an HIV negative individual. Learning about U equals U and that virally suppressed people living with HIV pose zero risk of sexually transmitting HIV to HIV negative partners has had a positive effect on her sexual health.
Hello, my name is Jennifer Vaughn. I am a 46-year-old single mother of 3. I was diagnosed with HIV about a year ago, and I am in a relationship with a man who did not get it from me, and that was even during the period where I was very sick, and maybe he should have, but he didn't. And so since then, we had spoken to my doctor about how risky it was for us to be together, and she has always recommended condoms and PrEP for him. And, in our minds, we felt that the fact that he didn't get it from me even when I had a high viral load was, something to think about, that maybe it was harder for a man to get it from a woman. So once my viral load went down, we didn't worry about it anymore. But I didn't know about U equals U. And that changed everything for us, because it was like, then there was proof, there was scientific proof. That was not something that my doctor told me. This is something that Bruce told me. And so it changed everything for me, because all of a sudden, because she's always recommended PrEP and condoms, which we didn't do, but it made me feel like I was still some kind of threat to him, that I would need to do that. And I would scratch my head and think, why, if he didn't get it from me when I had a really high viral load, why would we need to do all of that? And so, but she still recommended it, which just gave me this feeling that there was still something wrong with me and that he needed to protect himself from me. Thankfully, he didn't take that stance. And but once we had the U equals U information, it just changed everything. I mean, it made it, I'm like confident in telling people we don't use protection. We have amazing unprotected sex. And I have a private page with a bunch of women who are HIV positive, and we are spreading the word about U equals U, and several of the women are in relationships and practice the same thing, and we're all very comfortable with it and confident and very happy about it. And it does change how we feel about HIV completely, because we feel normal, and that's really key here in this situation. We want to feel like everybody else, and especially when it comes to being intimate with your partner, that's a time when you don't want to feel that there's something wrong with you. You want to feel like you're normal. So this backs up all of that, and it takes all of that stress out of that part of your relationship and makes it normal again. And so I'm very thankful for it, very thankful for everybody that's worked on this U equals U campaign.
Kevin was diagnosed with HIV 7 years ago. He also says that learning that HIV treatment as prevention and about the U equals U message has had a profound effect on his life, improving his overall outlook on life.
Hi everyone, my name is Kevin. I'm from Columbus, Ohio, and I'm just here to quickly share with you how the undetectable equals untransmittable message has had a profound effect on my life. You see, 7 years ago when I was diagnosed with HIV, I was thrown all kinds of information and told I had to use condoms. I felt like this infection roaming around the streets of New York City at the time. I felt dirty. And it wasn't until HPTN 052 came out that made me realize that, you know what, I may still be this 4% risk, but I'm not the risk that I was made out to be when I was diagnosed. And so, you know, then we have all the other studies coming out, partner, opposites attract, another, and the science is irrefutable. People living with HIV with an undetectable viral load for 6 months or more cannot transmit. That has profound implications on people living with HIV and public health overall. So it really upsets me that there are organizations here in the United States that are withholding this information from us. They are, in essence, telling us we are still a risk.
For Adriana, the U equals U message represents a powerful HIV prevention tool. She says it's important for people to understand that by achieving an undetectable viral load, she is both healthy and cannot transmit HIV to her sexual partners.
Muchas de las personas no saben su estatus o muchas de las personas no tienen un tratamiento correcto. El educar a esas personas y hacer que esas personas sean indetectables a tiempo, eso yo lo llamo salud pública.
Brian is a native of Cleveland, Ohio, and has been living with HIV for 36 years. He says the science of treatment as prevention can change a person's view of themselves and how that person is viewed by society. Brian says that medical professionals have a duty to spread the U equals U message because it allows people living with HIV to improve the quality of their lives and relationships.
Hi, my name is Brian Jones. Brian C. Jones, to be in fact. I'm from Cleveland, Ohio. I'm a person who has been thriving with AIDS for 36 years. What U equals U means to me, when I talk about this, it brings up a whole lot of emotions because for years, I watched a lot of my friends die. And many times I thought I was being left behind because like, why am I being left here? But now, since U equals U has come out, now I know why I've been left here to experience this wonderful U equals U message. The science is it changes the way we feel about ourselves, and it also changes the way other people feel about us. I always say you equals you is me equaling me, because for years a part of myself I had left behind. I felt I couldn't love again. I felt no one would love me again. I felt that I couldn't be open and honest and share my emotions and my true self with people. But when you equals you came about, you equals you is me equaling the real me, because I was able to add that part of myself that I left behind. You equals you is something to be celebrated. I know a lot of times people say, well, I don't believe it. I don't believe it. Because we've been conditioned to think that we're infectious for so long. So I often say to people who are living with HIV, ask them if they have an HIV diagnosis, and they say yes. I say, well, it's the same science that told you you have an HIV diagnosis that is now telling you that you can't transmit. So we owe it to ourselves to do ourselves a favor to embrace the science and for us to understand and interpret the science for ourselves. We can't sit back and wait on medical providers and stakeholders to share this information with us, because this is about our lives. And it's important for those people who claim to be allies, such as doctors, nurses, to openly share this information, because we have a right to know anything that concerns our bodies. And it's not about the have and have-nots, the undetectables reaching versus those who have a detectable viral load. I always tell people like this: the science is the science. It has no color. It's not black or white. It's not detectable or undetectable. The science is an advancement. So I tell people. Some people say, well, we shouldn't be sharing the message like this because we're shaming some people. So my analogy to that is, if you found a cure for breast cancer, so would you not tell those people who have breast cancer because you don't want to make all those other people with cancer feel bad? No, you share that information and celebrate that information. As someone who's been thriving with AIDS for 36 years, there was a time when I couldn't reach undetectable. When I first heard about the Swiss statement in 2008, I couldn't reach undetectable, wasn't on my radar, because I was on my salvage regimen. It wasn't making me any better, wasn't making me any worse, and there was nothing I could take because I was resistant to everything. So I knew at that point, but it made me feel good about the community. It made me feel good about the possibilities of our community. Even though I couldn't reach undetectable, I held on when there was nothing else except the will which said to me, hold on. And something came out, and I've been undetectable for the past 6 years. So to all of you who are saying, well, what about those who can't reach undetectable? This is just the tip of the iceberg. Who knows? Next year we may find out. The science says that we're not looking for that magic number of less than 20. It's a viral load of 200 and below. So next year we may find out that you can have a viral load of 10,000 and not be transmittable. So just hold on, be steadfast, stay adherent to your medication, and it gets greater later. Thank you.
Christian is an immigrant from Hong Kong. He says that the messaging of U equals U has become more well received over time in the Asian immigrant community. He believes that the U equals U message can also help encourage people living with HIV to overcome stigma and disclose their status to family, friends, and intimate partners.
The community in general. As you know, Asians living with HIV very often because of the stigma, we are still a lot of times invisible. People don't often want to come out with their positive status, and for me and some of my colleagues, we feel that it is very important that we actually spread this message more, so that people can actually understand that people living in HIV on effective treatment cannot pass on HIV to their sexual partners. How I actually would like to explain the science of U equals U is that sexual transmission of HIV cannot occur when the HIV positive partner or the partner living with HIV is on effective treatment. I think, just as opposed to saying that, people living with HIV cannot pass on HIV to their sexual partners when they have a suppressed or undetectable viral load, that kind of still places onus on people living in HIV. My wish is that one day such message can be more status neutral. And what does U equals U mean to me personally? As an HIV activist, I really feel that it's important that we engage in conversations about equity. So how is HIV treatment and services being provisioned to the communities? Since I work for a very specific community, a racialized community, a settler immigrant community, a lot of times we face multiple society barriers and oppressions that the mainstream communities may not necessarily have to face. So, for example, newcomers, immigrants, refugees, or people who don't have immigration status, they may have difficulty accessing medication or even healthcare services. So how can we actually ensure that all people living in HIV can benefit from U equals U? I think the first thing, spreading the knowledge is key. Yet I think we are in a great time to move on to thinking about how we can address the third U, the unequal part of access of treatment within the sector.
The powerful testimonials you have heard in this module speak to the destigmatizing nature of the U equals U message. They also demonstrate how we can leverage this message to drive demand for HIV testing and antiretroviral therapy, or ART, and promote treatment adherence to maintain a suppressed viral load. Clinicians bear a responsibility to inform patients about much more than laboratory values. Effectively communicating the U equals U message to people living with HIV is of utmost importance at diagnosis, when ART is initiated, and when viral suppression is achieved. U equals U destigmatizes an HIV diagnosis, and it drives demand for and optimal use of HIV services. Both can assist with global efforts to end AIDS as a public health threat by 2030. The next module in this e-learning activity will offer you guidance on messaging U equals U within your clinical practice. Please advance to Module 3 now.